Good morning. This is Babak Larian, Dr. Larian. Is a little odd to say sometimes. In any case, we're doing a Parotid Facebook live session, a Q&A session, and there's actually some questions about Frey syndrome that have come in, and I'm going to go ahead and try to answer that for you. Let me just turn this around and talk about the parotid gland itself, salivary glands, right? So, if you look here, this is the parotid gland. Parotid gland produces 10% of the saliva that we make in our mouth, right? This is the submandibular gland, which is a smaller gland. This one produces 25% the saliva we make. There are smaller glands here called the sublingual gland, and then there are about 200 tiny little glands inside the mouth and throat. They're all, if you look on the back side of the lip, on the inside, you'll see tiny little bumps. Those are all saliva glands. On the roof of your mouth, there's saliva glands. In your cheeks, on the back of your throat. So you're constantly making saliva from all directions, right? And so when the flow of saliva occurs, what you're getting essentially is, saliva being produced by parotid, and it's going down the duct into the mouth, right? By the submandibular gland, it goes through the submandibular duct and into the front part of the mouth. So the parotid puts its saliva into the cheek area here, right? The submandibular gland puts it through a duct that opens up on the bottom of the tongue, on the floor of the mouth, and comes out in the front. And the function of the saliva is to wash the mouth. Don't let and the concentration of bacteria to go too high. So a constant flow of saliva takes a lot of the bacteria that's in your mouth, sends it down into the stomach where the acid takes care of it. And so we control the amount of bacteria in the mouth. Obviously, we wash away pieces of food. We help begin the process of digestion and, more salivation and breaking down of the fruit products. So it's got a lot of functionality. But fortunately, like all other systems in our body, there is redundancy. So just like we have two kidneys and one is adequate enough to do the job, which is why some people donate their kidneys to a family member or a friend or someone else, and they still survive and do fine. So is this case for salivary glands. There's multiple salivary glands, and taking one out does not lead to you feeling like you have a dry mouth or any issues. So even in patients where we take out this gland, the submandibular gland, right, that produces 25% of the saliva that you make, even taking this out does not lead to the person feeling dry mouth, okay? So when you remove a portion of the parotid gland because of a tumor, so if you remove this much and the entire gland only produces 10% of your saliva, removing this portion or even half of it means just getting a 5% reduction, let's say, in your saliva. That's not an immense amount to impact the functionality of your mouth. So I don't find patients that just have parotid surgery complain about salivary issues or dry mouth issues or digestive issues at all. In fact, I don't think they notice any difference. Or if the difference is there, is so minimal that it's not something that they complain about. Even when asked directly, they say, no, it feels about the same. Fortunately. And again, it's because there's so many other glands to do the job, right? On the palate, on the lips, on the back of the throat, and so on and so forth. Now, to go along with this is the facial nerve that comes out and divides into the upper and the lower branches, right? The upper going to the upper lips, eye, and eyebrow. The facial nerve is not the nerve that gives the instruction for saliva production to the parotid gland. those instructions come from a different nerve, right? So a different nervous system, the autonomic nervous system, is what comes in and gives instructions, right? And this system has a different branching system that is not connected here. It comes from a entirely different place, and it gives branches all over the parotid, so that when you're hungry, it tells the parotid, right? Start producing saliva, get the mouth ready, get the mouth watering for the food to get you ready for saliva production, right? And so when we do surgery, right, on the parotid gland, and let me show you. This is a tumor development, and this is the surgery. This is a superficial parotidectomy, a traditional, in the most purest sense, a superficial parotidectomy, where you remove all of the parotid superficial to the nerve. Now, that's not necessarily what we do in every case. In fact, it probably is not necessary in majority of the cases to do that. But let's say you have a tumor down here, right? And you remove this much parotid gland, superficial to the nerve, right? And let's say all the other parts still have parotid covering, right? And actually, I'm going to make the tumor be green, right? This is the tumor we've removed along with the black portion. And so what's left now is this portion of the parotid still being covered, right? And this portion having been removed with the nerve exposed, the facial nerve. So those branches that were coming in and telling the portion of the parotid to produce saliva, that were coming in and giving branches in all directions and telling, have been cut. So what you see here, again, this part being covered, is you're going to have the ends of those nerve branches inside exposed, right? So these nerve branches that used to come and go to the portion of the parotid that has been removed have been amputated, right? So these were the branches, and the tumor was here, right? And those branches that were telling the parotid gland to produce saliva were cut along with the tumor and removed. So now you have these cut portions, the ends of these nerves. And as our amazing healing powers do this for us, our nerves are able to regenerate. So those nerves in time grow, hoping to reach the parotid gland, right? Not realizing that the parotid has been removed. And so what happens is that those branches can grow into the skin sweat glands and cause Frey syndrome. And that is what causes the sweating with Frey syndrome. So these nerves, every time the person who has had parotidectomy without a reconstruction, every time they get hungry, those branches cause the skin sweat glands to start sweating. And every time they eat, they start sweating. And it can be profuse. And it all depends on how big an area of the parotid was removed and how many of those nerve branches have grown. So the risk of getting Frey syndrome is very high when people don't have a reconstruction. But there's absolutely no reason not to do a reconstruction, especially for a benign tumor, right? And even the low-grade cancers. Definitely a reconstruction is a necessity. So let me explain how that's done. Let me flip this around. When you do a cross-section of the parotid gland here, I'm going to turn the camera a little bit. Actually, zoom out so you can see. The parotid over there is going to look like this, right? The facial nerve is going to be in the deeper portion of the parotid, right? And so since the tumor was superficial to it, and the tumor and a portion of the parotid superficial to the nerve were removed, right? So now what you have is this. Oops, sorry. Actually, I'm going to erase this. So now what's left is that, with the facial nerve being here, right at the edge there, right? And this portion of the parotid again being covered, right? And you also have the branches that came in and went to all over the parotid to tell it to produce saliva, coming right to the edge, right? That are cut. They're exposed here, right? So these areas, and I'm going to point at them with green. Here, 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 and here are exposed nerves that only control the production of saliva of the parotid gland, right? And these nerves are now exposed. Now, if you don't do a reconstruction and you lay the skin back down like this, not only is the person going to have a divot, but these branches in time grow into the skin. And now they're going to make the skin produce sweat. So you're going to have sweating on the skin here, right? But there's a very good way of preventing that from happening. And that way is by putting a barrier between the skin and the parotid. Something that the nerve cannot grow through, right? And so let me tell you how we, at our center, we do this thing. And it's been very successful. So the way we do it is, again, you have the parotid that's been partially cut, right? With the facial nerve branch right there, right? And the cut branches right at the surface here, right? So what we do is we use a muscle flap. So we get a portion of the muscle that sits right here in the neck, right? And we rotate that muscle into the area. We fan it out and we cover the parotid, right? Remember, this top portion of the parotid still had parotid covering the facial nerve because we didn't remove it, right? Those areas. And the muscle is still attached, right? And we're not using the entire muscle, right? We're using just a small portion of the muscle and fanning it out, right? And if you do a cross-section of the muscle, here's the cross-section of the muscle, we are using just a quarter of the muscle to do our reconstruction. So the muscle is intact and the person doesn't have any deficits in the long term. They have no limitation in neck movement or strength of neck or strength of turning the head or anything, right? Because this muscle starts here and goes all the way to your chest bone, the collar bones. In any case, so we bring the muscle and we put it in here, right? So we cover the parotid so the person doesn't have a divot and this barrier. We also use something else. The parotid gland, when you look at it, I'll do a mini version of the parotid gland, right? With the facial nerve again here. On top of the parotid gland is a thick covering. We call it a parotid fascia, right? So let me show you that. So the parotid fascia is here, and then there's skin on top of it, right? During surgery, we lift the parotid fascia, the covering, and the skin, right, to get to this area. And once we do the surgery, we put the muscle flap on, we're going to lay that green area down. So at the end of the surgery, not only do you have a muscle covering it, but you have the parotid fascia and then the skin covering it. So you have 2 layers of separation. The muscle and the parotid fascia separating the nerve ends from the skin to prevent Frey syndrome. In people who have a smaller tumor, right? So this is for relatively larger size tumor. So if someone has a smaller tumor, let's say something small like this, where we remove the tumor and in a small area of defect, right? So in this particular case, the parotid is gonna, so this was, the tumor is here, small, right? And this is the amount of parotid that we removed. So this person is gonna look like this. So the parotid for this person is gonna look, right? And the facial nerve could be right at the edge there or a little deeper, regardless. When you've taken only a small amount, you don't necessarily need a muscle flap. You can oftentimes suture the 2 ends of the parotid together, right? So what you can have is a parotid that ultimately looks like this. With a nerve at the end of it, and you've sutured this 2 edges of the parotid together. When you can do that, then you don't need a muscle flap, and you don't have a divot anymore, but you still have the covering, the parotid fascia, that you can lay on it as a secondary barrier, separating the parotid from the skin. So, basically, what I'm trying to say is that Frey syndrome is completely preventable. And it makes really no sense not to do a procedure that prevents Frey syndrome from happening. And that's really important. So when you guys sit down with your parotid surgeon and you're talking about how to do the surgery and what they're going to do and what's involved, please ask about Frey syndrome and what they do to prevent that. Because there's absolutely no reason to have Frey syndrome. It's a completely preventable thing, and it should 100% be prevented. It's just not necessary to have to deal with that, okay? Anyways, I hope you found this helpful. That's the end of our session, and I'll see you guys next month. Have a wonderful day.